So in this video, I want to talk about the alternative approaches to tension headaches. As we spoke about, there's a real need for these additional modalities to treat the tension headaches because the medications we have so many side effects, and they lead to also medication overuse headaches, and sometimes we have to take people off of certain medications because there's a rebound headache from the medication. So certainly there's a real need for these additional options that people can use. Um, so we talked about some of the conventional options that you would use. That would be the non-steroidals, which you're using it kind of more episodically rather than chronically, although sometimes it is used chronically. It's not recommended to use for more than 20 doses typically in a month. Again, depending on the person, it may be something that they can't use at all because they have kidney problems and other issues that totally preclude the use. And then there's the medications to prevent the headaches. A lot of them are antidepressants and sometimes anti-seizure drugs. So those are the conventional treatments. Now going into more of the integrative options, one of them is kind of looking at your whole lifestyle and seeing how much do you pay attention to sticking with a routine from day to day basis, or is your schedule changing rapidly? How is your sleep wake cycle? How's that going? Is that something that you more or less schedule the time and you're consistent with it even on the weekends? It's not something that's changing a lot, because that's really important too. Sleep is an important part of preventing tension headaches. Sleep hygiene is really important. In terms of sleep, getting a relaxing ritual done before sleep that you do every night, that really helps. And it could be a bunch of things. It could be like a little bit of self-massage. It could be some meditation. It could be writing in a journal. It could be listening to guided meditation. All of these things kind of put you in a more relaxed atmosphere, and you just have better sleep, which is really important for all pain syndromes. And tension headaches and headaches in general are no different from them. You really want to dial in on a good sleep routine for that. So the other issue is, what's the quality of sleep you're getting? How refreshed do you feel when you wake up? All of those things kind of will impact your headaches, and how much you change your sleep-wake cycle. Like I said, that's really important too, being consistent. The second aspect of your lifestyle that's huge is nutrition, of course. Nutrition is extremely important, and a lot of people with tension headaches have an overlap between their tension headaches and their migraine syndromes, in which case they often notice there's a little bit of triggers associated, like the migraine triggers for a lot of people could be chocolate, it could be red wine, it could be cheese, it could be any of those things that really trigger the tension headaches, and the same things can trigger the ones that trigger migraines. For some people, there could be absolutely no relationship with food at all, but either way, there's still going to be a benefit to you working on your nutrition, even if you're not really having triggers specifically. And one of the things to know whether you are having triggers or not is also keeping a food diary and doing a little bit of elimination, and that way you would really know. And with elimination, one of the big things I would really work on eliminating is like sugars of all kinds, all added sugars, and that makes a big difference for headaches in general. And hydration makes a big difference, and that you're hydrating with just water, nothing but water. That makes a big difference too in your headaches, because all kinds of artificial sweeteners, flavoring agents, they're all ultimately some types of chemicals, processed foods, no matter how natural they claim to be. So they could be playing a role in your headaches. So that's something to really look at, and you won't know unless you eliminate for 2 weeks and then probably reintroduce and see how you felt in the 2-week gap when you weren't using it. And like I said, all the sugars are huge because they kind of increase inflammation. And for some people, dairy can be a big part too. So you just have to, again, look at that. Dehydration is really important. All the dehydrated muscles tend to contract more. They are also more painful. So again, really honing in on your water intake, that really helps. Omega-3s, extremely important part of nutrition is omega-3s, because you want to have more omega-3s. So in a Paleolithic type of lifestyle, human beings had a ratio of 15:1 of omega-3 to 6. And currently we have like, it's the opposite, it's 1:4, and we, at the very least, we want to increase it to 4:1. So we want more omega-3s than 6. Omega-6s, we get it all the time because it's there in all vegetable oils. All processed foods are really loaded with omega-6. But omega-3s, it's more of the nuts and seeds and the fatty cold water fish, salmon, sardines, those type of things. They're really high in omega-3s. And I still don't recommend doing too much canned food, so ideally still fresh when you can. You can also do more omega-3s from plant sources, which is more alpha-linoleic acid, but still very good. The flax seeds, there's chia seeds, walnuts, pecans. They're great ways of adding in some omega-3s every day to your diet. So omega-3s have a lot of evidence when they're done as nutrition, not so much evidence when they're done as supplements. And I've had some people add them in as supplements, which is okay, but it's definitely better as nutrition, working on it as nutrition.